The Guyana National Emergency Medical Service Phase 1 was launched on Thursday. It is a collaboration between the Guyana Fire Service and the Ministry of Public Health.
The public health system is a patient-oriented and time-driven one. And we at the Ministry of Public Health are always examining ways to improve access to healthcare services. And we also make every effort to improve on the quality and the equity of the healthcare services. Efforts continue to be made by removing all barriers to accessing healthcare services.
Public Health Minister Dr. George Norton. The program begins with 3 ambulances in addition to several trained emergency technicians with centralized services in Region 4. Over the next 5 years, the intention is to expand the program with more personnel and vehicles.
What we're in the phase of doing now is to amalgamate EMS and fire into one operational standpoint and one operational platform where emergency call for either fire or medical will be routed to one operations room and the dispatch will be managed from that room, from that area.
Fire Chief Marlon Gentle. So from 2010 to 2012, a pilot project was initiated, but that did not impact significantly on the number of persons that were being taken to the ER without the assistance of the trained personnel. That led to the development of a pilot EMS at the GPHC in 2014.
When Minister George Norton took office, this is by no means me being patronizing. When he took office in 2015, one of the first things I did, I think that was probably the first documentary review because I was so passionate about getting this done. I took the National EMS document, which is about 120 pages, to his office. So I knew I was giving my new boss, quite a lot of work. But this is the major turning point. This is one of the 2 major turning points in the history of EMS.
Firefighters and police officers are usually first responders. Now, having these personnel equipped to respond is critical. Here is Dr. Zulfikar Box, Medical Director of the Emergency Medical Service.
A police officer was hit down by a motor vehicle and he was brought by his colleagues and they were holding him hanging down by his hands and his feet. They didn't know to do better how to transport him. Unfortunately, he suffered spinal injury and he's paralyzed for the rest of his life. And those kind of things made me realize that we need to do more for the persons in the public setting.
The program officially gets going on Monday. The current phase is to be used for troubleshooting. Handel Duncan, HGP Nightly News.